better than non-fat?
Oh, I wouldn't say full-fat yogurt is better than non-fat. It's kind of a moot point, which is better, because you don't get much benefit from reducing fat because the protein concentration is enhanced when you take the fat out, and the higher protein raises IGF-1, which is a promoter of common hormonal cancers like breast and prostate cancer. So you could say that low-fat dairy is still cancer promoting, but the saturated fat in dairy products, worsens diabetes, deforms insulin receptors, raises cholesterol, and has other negative effects. Even the CD36 receptors on cancer cells are exacerbated to allow metastases. So who knows which is better, low fat? What's the point is that when we're using dairy, we have to recognize that it's a hormonally sensitive food, and it should be used in very minimal quantities, if at all. So whether low fat or full fat, keep it down to a low amount or skip it completely.
Well, now we're live on all of our venues, and so I'll officially welcome everyone. It's 4 o'clock Pacific, 5 o'clock here in Costa Rica, 7 o'clock on the East Coast, midnight in Dublin, 1 a.m. in London and most of Europe, 8:30 and 9:30 a.m. Wednesday morning in Australia, 1:30 in the afternoon in New Zealand, and it's Facebook Live. Hello, everyone. And our guest today is a very special guest, Dr. Joel Fuhrman, who is world-renowned. And I'm going to do the introduction of Dr. Fuhrman in just a minute. We have excuse me, but more important guest who's here right now, whose patience might not last very long. So for everyone that loves to see our son, Gio, Gio just came onto the swimming pool, but he wanted to get in here quickly. So this is our little boy.
A cuter version of you.
Oh, thank you so much. That's a great compliment. Thank you. So, Dr. Fuhrman, let me just tell you about Dr. Joel Fuhrman. And I'm going to read this to make sure I don't miss anything because it's really quite exceptional. Dr. Fuhrman, Joel Fuhrman, is a board-certified family physician, 7 times New York Times best-selling author, which means he knows how to express very difficult concepts in ways that people can wrap their heads around. So I'm really thrilled that he's here with us today. And he's a nutritional researcher who specializes in preventing and reversing disease through nutritional methods. At his Eat to Live retreat in San Diego, California, and through his books, television specials, and virtual speaking engagements, Dr. Fuhrman shares his life-saving nutritional protocols with hundreds of thousands of people around the world seeking to recover from obesity, food addictions, diabetes, heart disease, autoimmune disease, cancer, and other serious health concerns. So it's a real privilege to say, welcome, Dr. Fuhrman. Great to have you here.
Thank you. Looking forward to this. Wish I could have been doing it at a different location, but it's better than none, right?
You know, I've actually had to do this twice before at the San Diego airport because I used to live there also. And so I know that feeling when there's busyness all around and the PA announcements come on, but we do the best we can whenever we can. George Harrison said, doing the best you can as long as you lend a hand, right? So, and you certainly are doing a hell of a job in that in the world. So the first question that came up, actually, Dr. Fuhrman, when they're doing announcements, if you could mute at the same when.
Oh, that's a good idea. Thank you for that.
The first question that came up before we were live on all the platforms was, why is non-fat or low-fat yogurt better than high-fat yogurt? And Dr. Fuhrman's answer was, well, it's not necessarily. And he gave a number of reasons for that. The follow-up question is, how do you compare standard yogurts with goat milk yogurt or Greek yogurt or coconut yogurts? How do people hold those different forms of yogurt?
Well, you and others may know, I advocate what I coined the term a Nutritarian diet. And that's a diet rich in vegetables, because vegetables and our favorite carbohydrate source are beans, which are also rich in protein. And our favorite, you could say, favorite rich protein sources are seeds and nuts, and beans are high in protein, and green vegetables are high in protein. So the point is we're trying to eat a diet that's protein adequate, mostly from plants, and to minimize the amount of animal products consumed in the diet, because animal protein behaves biologically different than plant-based proteins. As a matter of fact, if people ask me what's the most significant and you could say remarkable research that's come out of the scientific literature in the last 5 years, it would be that more protein in the diet enhances lifespan, but only if the protein is coming from natural plants, not if the protein comes from animal products. So we're saying here, more plant protein means more greens, beans, and nuts are the highest in seeds, the highest protein plant foods. Soybeans, red beans, more plant protein, less animal protein. More animal protein, more premature death. That includes dairy protein. So we're looking to reduce our exposure to animal proteins and enhance our exposure to plant-based proteins to extend human lifespan. So critical. Even showing that even plant-based or vegan diets that are lower in protein don't have as much potential to extend lifespan as plant-based or vegan diets that are higher in protein, better designed. So really a fascinating and interesting research. So getting back to this, well, now among yogurt, we're already trying to limit our consumption of animal products, and yogurt is one of those animal products. May not be as bad as others, but it's still in this limited category because dairy products still can raise IGF-1, a hormone that allows cellular replication and cellular growth that could be cancer promoting. So we're talking here about if you do consume animal products, keep it to very low amounts, and it could be a yogurt once or twice a week, but that would be the only animal product you would consume then. And then, then the issue is dairy better than cow's milk versus goat's milk. I don't think those questions are that critical because we're minimizing the consumption of that to such a low amount that whether you have an organic cow's milk yogurt or a goat's milk yogurt, you're using it so sparingly or even occasionally that the difference shouldn't make a big difference. If you're eating those things every day, they're not going to be a good part to include in a larger amount. So the question becomes less important when you're either not using those type of foods or using them in such small amounts. And by the way, yogurts and coconut yogurts and dairy yogurts, they're still not seen as a rich anti-cancer food, rich in phytochemicals and antioxidants. In other words, we're dividing food into 3 different categories. Produce is one category, which is phytochemical rich, which protects cancer and extends lifespan. Processed foods, which don't contain phytochemicals and antioxidants, they're micronutrient poor, and animal products, which are usually protein and fat rich and don't contain any phytochemicals and antioxidants. So the yogurt usually has jelly in it. It's usually overly sweetened with high glycemic effects, and it's not nutrient or phytochemical rich. So it's not a food we're looking to increase in our diets in significant amounts. It's one of those foods we're looking to reduce in our diet. So when reducing something, obviously the question about utilizing which type becomes less important.
Thank you for that. Mary asks, is your Eat to Live to Eat program good for someone who isn't interested in losing weight? It advertises a lot about weight loss advantages. I'm interested in eating healthy and a balanced diet that includes everything I need. Is this better than buying your books? I'm interested in great recipes to follow too.
Well, thanks for that question. My most recent book is called Eat for Life. It's always best to get an author's most recent book, I think, because you get more updated references. And that book has like 2,000 references in it. They all have great recipes. And on my website at theDr.com, I have more than 2,000 recipes that are searchable and scoreable. But and I even have recipe books. So it's not. So we try to make eating healthfully as delicious as it could be, so people feel like this is a really pleasure to eat this way and to protect our health. So my most famous book that sold millions of books, that sold the best, was called Eat to Live. So we called my retreat in San Diego the Eat to Live Retreat. Remember, my most recent book is Eat for Life. My older book that was very, very well known worldwide was called Eat to Live. So the retreat is called Eat to Live, and people that come there stay for 1, 2, 3, or 4 months, And they usually come there because they have either they're overweight or have some medical issue they have to address with me. And so we reverse them off, get them off the medication, solve the medical problems, resolve their food addictions, and get them to enjoy eating this way and with the skills to be able to apply it in their home for the rest of their life. But some people do come in, like there's a couple of people there this month that are just there to have fun. They're healthy, they eat healthily, they're slim, and they just want to play pickleball, play volleyball, hike in the mountains, and go to the beach and with me on the dog beach. They're just going to have Nutritarian chefs make their. So there's we do have sometimes people come just to have a good time in the beautiful surroundings and the beautiful setting, and they don't really have a medical problem. But I'd say 80% of the time, people are there with something to help their medical issues. So the question is saying, I think she's saying, is coming to the retreat better than buying a book? And or was, I don't know, but whatever is she's saying, I encourage people to start somewhere, but it's usually buying a book is better. You know, you come to a retreat, you don't know what you're getting into. It's better to buy a book. And then if you want to come to the retreat, or you have some difficulty, or you're trying to change your diet and have trouble doing it on your own, you could always come in and stay with us. But obviously most people across the country aren't going to come to see me and spend months there. They're going to just read the book, watch videos, and sometimes they can join the website, my personal website, and communicate with me through the member forums there. And we can give them encouragement and a feeling of camaraderie and answer their questions. They don't really have to, come and stay at my retreat for months.
Yes, I'm laughing of two things that you said in there. The first, and I'm hoping everyone noticed how casually you refer to reversing their autoimmune diseases and reversing their problems and get them off their medications. And it's so casual because you do it again and again and again and again. And for most people, it's hard for them to wrap their heads around when they've got diabetes and they're on high blood pressure medication, that their lives can transform dramatically within a few months once they learn the lifestyle habits that will support health and not disease. But you were just so casual in how you referenced it. I thought that's great, but I hope people catch it, that it's an everyday occurrence in Dr. Fuhrman's practice and in many practices around the world that practice this type of holistic healthcare. It's an everyday occurrence where people safely can be weaned off their medication and not require their medications anymore. The second point that you made was sometimes people come to you and then they just want to go to Dog Beach. And I used to live there, and I drive by Dog Beach once or twice a week, and I always wondered, why do people go swimming at Dog Beach? Because that's where everybody brings their dogs, and the dogs are peeing in the water, they're playing around. Yet there are people going out there in paddle boards.
It's an ocean. You're not worried about dog urine in the Dog Beach. It's funny. I have a Beauceron dog. She's such a protector that when a little kid, like a 2-year-old kid, goes in the water, she goes next to this 2 or 3-year-old kid and stays next to the kid so the wave doesn't knock over the kid or the kid can grab onto something. So it's when a little dog or a little beach, she's there trying to protect the kid. So it's so cute to watch the dogs play, and they run like lightning and they fly into the water and they jump over the waves. It's just a fun place to be. The Del Mar Dog Beach. I'm putting an ad in for the Del Mar Dog Beach. I love it there.
I know that beach well. Let's see, Michael's on Zoom and he says, if someone is metabolically healthy, why does a diet high in red meat, nuts, honey with some fruit lack sustainability? I've considered mixing this diet with a quarterly detox program, such as one from the Toxic Solution. Please convince me otherwise. Okay, Michael.
I was just hesitating for this announcement to be. One thing we have a good handle on today, we have more and more corroborating evidence that as animal products increase in the diet, so does the risk of premature death from almost all causes, including heart attacks, stroke, and cancer deaths. So we're trying to minimize animal products. The American diet is about 25% of calories, is about 30% of calories from animal products. But above 25%, even the people that are most genetically favored still result in developing heart attacks and cancers when they eat more than 25% of calories from animal products. In the 10 to 20% range, and around 15%, then genetics start to play more of a role. And you see a scattered, lower amounts of serious diseases, but a scattered amount with some people more susceptible to the damage from animal products. Below 5%, you generally don't see the increased incidence of cancers and heart attacks, and you're into a zone that facilitates reversal. So we're trying to say that even in the Seventh-day Adventist studies, which we give those studies so much credence because they generally study people with a lower level of animal product consumption. And we can compare vegans to flexitarians, to those eating a couple of servings a week, to smaller amounts, and they don't generally smoke or drink, and they have large numbers of people in those studies. And then, so we found in those studies that even moderate consumption of animal products have the effect to shorten lifespan, and even a couple of servings a week are significant effects at shortening lifespan. So it seems to be that a conservatively supplemented plant-based diet that holds animal products to less than 5%, which is not more than 1 or 2 small servings a week or none, is more lifespan favorable. In their studies, they showed that the nut-eating vegans lived the longest, but those vegans that didn't eat any nuts and seeds, the diets were too low in fat, didn't live as long as those flexitarians who ate some animal products but also ate nuts and seeds. So we're talking here about using this data and seeing if there's corroborating evidence from other studies that are also large studies that have high credence values, because they look at people long-term and look at hard endpoints like death. And the answer is yes. We have numerous studies that corroborate this information, with very identical information from various cohorts around the world, giving this data more definitive and substantial credence that we can hold our hat on. So I'm saying if you're going to eat animal product, you just got to use it as a condiment or a flavoring, and not be a significant part of your diet. We're saying as a condiment or flavoring, certainly for under 8 ounces a week for a male and under 6 ounces a week for a female. And we're eating our diet otherwise to be largely from plant foods. Most people who I advise and most people that follow a Nutritarian diet that I recommend don't eat any animal products, because when you have a trouble with a medical condition or even overweight, eating a little bit makes you want more and keeps your desire for these things. And when you have clear boundaries and they're out of your mind and out of your dietary plate, it's much easier to control your tendency to overeat or to eat things that are continuing your difficulties you have with your medical condition. So it's easier for people to do this 100% as it is to dabble in animal products or dabble in processed foods or dabble in oils. We'd rather people jump in and do this 100%. It actually becomes easier. Then the magic happens. They lose weight easier. Their disease reverses better, but most important, they lose their cravings and desire for those foods. Whereas the continuum, having a small amount, keeps you wanting them more. So unless you're really if you don't have any addictive sensations and you can control what you eat, then having a little bit a couple times a month is no big deal. But if you're like some person with a trouble with weight and have some emotional and addictive eating tendencies, then you're probably better off keeping it out completely. You follow me?
I do, of course I do, of course. And I'd like to follow up on that question on most of the studies that have been done on meat consumption, I'm assuming are based on the meats that people are eating in their diet. And the vast quality of the meats that people are eating is really garbage meat. High-stressed animals, lots of chemicals used with them. Have you seen any differences with organic versus inorganic in terms of chicken and beef?
Salamander, frog, rattlesnake, or wildebeest. That was a joke.
That was a good one.
Good laugh. It's okay. The answer is that there are, most of the studies are done from other countries like Australia and that use natural grass-raised animal products. And there's, at this point, a lot of studies that don't show no difference between what type of animal product is used, even when they're using more pasture-raised and wild-fed animal products. It's the protein content of the animal product. When you over-consume your biological need for protein, the body can't as easily convert into fat. So the extra protein is more readily converted into growth hormones. And those excess growth hormones, is measured mostly by IGF-1, insulin-like growth factor 1, is permissive to allow angiogenesis and cellular replication. And so and saturated fat also binds to the insulin receptors. And the hallmark of healthy centenarians is to have a high degree of insulin sensitivity, not insulin resistance. And saturated fat makes the insulin receptor not work as well. So both the fat in animal products and the protein, even low-fat animal products, drive up growth-promoting hormones. So we're trying to keep angiogenesis promotion low, IGF-1 low, and insulin resistance low at the same time. And so we really have a tremendous amount of knowledge how to enable people to live to be healthy and 100 years old. My message is that we have this unprecedented opportunity in human history to use nutritional science to really give us the opportunity to not have a heart attack, not have stroke, and really have protection from cancers, so we can live into our later years without fear, with passion, with excitement, fully enjoying our life with our full physical and mental faculties intact.
Amen to that. Amen to that. One of our favorite families here on Facebook every week from Iowa, their, I believe, 11-year-old daughter, please excuse me, Gracie, if I've got your age wrong. Gracie has a question. Does eating gluten-free help diabetes? My grandpa is diabetic. He has a continued glucose monitor and a pump. I like to bake, but he can't eat many sweets. How can I help him, and what are good snacks that I can make for him?
Well, I like people with type 2 diabetes to realize that they have to get rid of it, and controlling it and watching their diet is not the issue if you're still diabetic. That means I'm saying don't treat it, don't control it, get rid of it. Because you're still diabetic in any form, you're putting yourself at a heightened degree of danger. And that means that for a female, your body fat should be below 25%, and for a male, your body fat should be below 15%. And that means we have to adjust your diet accordingly. And I'm sorry about the announcement. I'll pause for a second here.
No, it's okay. It's okay. You're coming through over just fine.
I'm unmuting now. We're good now.
Okay.
Yeah, what I'm saying is that I encourage you to read one of my books, particularly my book, The End of Diabetes. And I'm addressing both type 2 diabetics and type 1 diabetics, because I'm saying right here that the reason type 1 diabetics die so young is because they require so much insulin to control their blood glucose. It's the extra insulin they require that cuts short their life. And it's using insulin or using drugs that push the beta cells in the pancreas to produce more insulin that shortens the lifespan of type 2 diabetics. So what I'm saying right now is that we have a diet where most of the carbohydrate comes from beans and low sugar fruits. It doesn't come from grains. Even whole wheat flour is not as favorable as beans, let's say, or peas, or butternut squash, or spaghetti squash. So in other words, what I'm saying right now is that even anything ground into a fine flour is more glycemic. So we might make desserts, like we might make a bean brownie, beans with a little bit, or we might make what is it called? A panna cotta with soy milk and agar-agar into a jello with a little vanilla and a couple of slices of banana in there with soy milk. We're making desserts that are not quite sweet. We have a whole list, a whole series of incredible desserts for diabetics that are low in sugar, and we use frozen berries to make sorbets and things like that. So we're using natural foods. We're not even using much date or any even dried fruit to sweeten them. We can make great tasting desserts that are not as sweet. And then, excuse me one second, what I'm saying here is that the glycemic of the meal is low because the meal includes a salad, some vegetable bean soup, or a cooked green vegetable or chili, so it has these low glycemic foods already in it, and you add a fruit-based dessert or frozen fruit on top of that, and you're not going to have a glycemic spike because the vegetables and the beans counter the effects of the fruit, and fruit becomes really our only, you could say, somewhat moderately glycemic food that we're eating. So we're not using conventional flours and conventional desserts like cookies and bagels and pretzels and chips and flour-based desserts and baked goods, unless we're using baked goods where beans become the primary holding it together, because beans are lower glycemic. And there we could also use some bean-derived pastas that are lower glycemic to mix with vegetables and peas and tomatoes and onions and mushrooms and a Thai curry sauce made with lemongrass and a little bit of, so in other words, we make great flavors. But of course, I'm saying you're a nutritarian only if you're at your ideal weight, or you're moving towards your ideal weight at least 2 pounds a week. So if this gentleman with diabetes is not losing 2 pounds a week, then he's not doing the right thing. He's not following the right program. Has to be losing 2 pounds a week. Because when you're overweight and losing weight, it automatically improves insulin sensitivity, the fact that you're dropping weight, and it stops all the spewing out of lipokines and cytokines of pro-inflammatory substances from the fat supply. Fat cells are pathological disease tissue. They don't get a good blood supply, and they collect toxins and they release pro-inflammatory compounds that can impair immunity, increase risk of infectious death like COVID, but increase all-cause mortality and age the body rapidly. But if you're overweight and dropping weight, the fat cells automatically start to improve the damage. You see less inflammation coming out of them. You see insulin resistance going down. You see less angiogenesis promotion and less activation of aromatase, which means you don't see as much estrogen production from the fat cells as people are steadily losing weight. So this is an opportunity for people to get well and get rid of their diabetes.
So Gracie, as an 11-year-old wanting to bake something for her grandfather, what Dr. Fuhrman is saying, Gracie, is that it kind of depends on how much effort your grandfather's willing to put out to get healthier. If he's really willing to get healthier and he's just not sure what to do, you can study this whole concept of glycemic index, which is what Dr. Fuhrman's talking about, meaning how much sugar does your body think is in the food you're eating, whatever the food is. And if the glycemic index is high, it tends to make your diabetes a little bit worse. It makes your insulin sensitivity worse. If the glycemic index is low, that food will be more healthy for your grandfather. So there's not a simple answer, but I can tell you that Dr. Fuhrman's website, and he said he's got 2,000 recipes there that you can count on, that the recipes he's got there will be safe for your grandfather. And if he's willing to do the work, he needs to eat like a big salad every day with all kinds of vegetables in it to fill him up so that he doesn't want pasta, right? My friend and Dr. Fuhrman may know also, I'm going blank on her name. Oh, she's my good friend too. She's a neurologist, had multiple sclerosis, and herself. I'm going blank on her name. It'll come to me in a minute. But when she works with patients, she tells these soldiers that came back from war and have really post-traumatic stress disorder, that they can't eat any pasta until they eat 12 cups of vegetables. So 12 cups of vegetables first before any pasta. And the result is they're not too hungry for the pastas after that, or too many baked goods, because pastas are harder on your blood sugar. They make it more difficult for your blood sugar to stay stable. So if I can give you a quick answer, Gracie, it's go to Dr. Fuhrman's website and look at all of his recipes, and you'll find some good ones there. Terry Walls, thank you so much, Priscilla, and Terry Flitch and Cindy. Everybody said Terry Walls, Terry Walls, Terry Walls. Thank you all very much for putting that in there. Of course, it's Dr. Terry Walls. And but Gracie, thank you for your question. Next question. I listened to all of your Facebook Lives and webinars. Recently, I was listening to an interview with Alessio Fasano, and he said that he doesn't recommend gluten-free for everybody, but moderation for everybody for sure. So why do you recommend gluten-free? It's also confusing to me. Help. Thanks, Jill. It's a really good question. And I recommend, your immune system is the armed forces in your body there to protect you. It's the Army, Navy, Air Force, Marines. And if your immune system is activated fighting wheat, you don't want to eat wheat anymore. So to really know if you should be gluten-free or not is to do a test and see, because many of the complications of wheat and gluten, you don't feel it when you eat it if it's creating more antibodies affecting your brain or more antibodies affecting your thigh. You can't feel it when you eat it. So you can't say, well, if you feel okay when you eat it, it's okay. You have to do a test to see, is my immune system fighting wheat? And there's a really, the most sensitive test we've ever found is called the wheat zoomer, because you zoom in on the problem. It's highly sensitive, highly accurate, and that is the way to know, do I need to go gluten-free or not? So Professor Fasano talks about moderation, and everyone should do moderation. Well, I understand his concept and I respectfully disagree, but I think that for every individual, the bottom line is, are you making antibodies to fight wheat? And if you are, you need to back off from eating wheat for a while. Dr. Fuhrman, anything you want to add to that one?
Well, I'd like to say that sugar is not a food, it's a drug, and it stimulates centers of food addiction in the brain. And I'm saying white flour is a sugar equivalent because it's just as glycemically unfavorable. And most people are eating bread and bagel and pizza and burgers, and they're eating a lot of white flour products. And besides those that are gluten sensitive, it's just destroying people's health and creating an immense amount of human tragedy, that it causes depression. So I'm saying there's a relationship, a dose-dependent relationship between eating commercial baked goods and depression and other mental illnesses. Even 2 servings a week of fast food or commercial baked goods double your lifetime risk of developing depression. And it goes up from there in a dose-dependent manner. And it causes a degree of dysthymia across our population. So don't underestimate the danger. And I call it a drug because when you eat these processed carbohydrates like bagels and pizza and cake and pretzels, when you eat those foods, the body can't efficiently turn it into energy because you're not getting cofactors, vitamins, phytochemicals to diffuse the production of energy. So because it can't be converted into energy, it's more readily converted into fat, and it leads to you to feel lethargic, tired, and fat and heavier, and so it's a real drug-like effect on human physiology. So while you're talking about this gluten issue, I'm thinking about how every person walking through the airport is almost 90% of people are committing suicide with the foods they're eating. And it's not just about the gluten, it's also about they're eating these white flour which have drug-like effects on human desire to eat. They overeat calories and it makes them want to overeat, and it's dumbing down their brains and affecting their emotions because these are dangerous foods to be consuming.
To reinforce what Dr. Fuhrman is saying, the technical measurement is called the glycemic index of a food, means how much sugar your body thinks is in that food. And 2 slices of white bread, the glycemic index is higher than a Snickers bar. So your body thinks you're eating candy bars in terms of how much sugar you're getting when you eat bread.
Bread is candy.
Yeah.
It is candy. And if you think you can live on that, you're going to be, you're going to have what happened to you. You're going to get in trouble and get serious illnesses.
Amen to that. George asked, does sugar feed cancer?
Well, cancer is fed by a lot of different things, but we're talking about that one of the factors in the American diet that fuels cancer are these high glycemic carbohydrates and sugar, honey, and maple syrup. But the studies on preventing cancer and with plant foods like vegetables show that when you add fruit, fresh fruit, beans, pomegranate, cherries, when you add fruit to a vegetable-based diet, you enhance its anti-cancer effects. You don't diminish them. So the question should be, does processed sugars and processed carbohydrate increase risk of cancer? Definitely, but not when you're getting your sugar in a nature's package. We're talking here about eating berries, which have anti-cancer effects. We can eat wild blueberries in the wintertime. We can get them frozen. We can get all kinds of beneficial anti-cancer foods and still taste things that are sweet. So we don't have to avoid all things that are sweet, just
Right.
processed foods.
Right, right. Mary's on Zoom and she asks, what should you do when your gallbladder has been removed?
Well, the same thing you should do if you have a gallbladder. You shouldn't do anything. You should just learn how to eat a healthy diet that prolongs human lifespan. And the gallbladder is needed when your diet is higher in fat or higher in high fatty animal products for digestive purposes. But if you don't have a gallbladder, you have no problem with that. If you stay on a diet that's mostly plant-based, that's a relatively favorable percentage of fat. We're talking about a favorable percent, which is somewhere between probably 15 and 30% of calories from fat, not to eat a diet that's way high in fat, and avoid animal fats.
Mary, I would add to that a little bit more that there is a risk of developing an insufficiency of fat-soluble vitamins. If your body can't absorb the fats very well, you may not take in enough of the fat-soluble vitamins in your diet. So you would just want to check maybe once a year, once every 2 years, what are your levels of vitamin A, D, E, K? Are you getting enough of these fat-soluble vitamins into your system? And if you have had your gallbladder taken out, it's possible. So you just want to check and make sure that what you're eating is adequate for your needs. Do you consider fish and seafood animal products?
Yes, they're an animal product, and they, now we're dumping, 2,000 tons of plastics into the ocean every hour. And even the smaller fish, which used to be cleaner, like oysters and sardines, are now still contaminated with microplastic particles. And the average American now has a credit card amount of plastic in their body, which creates hormonal problems and is carcinogenic. So yes, I consider fish also something to be very careful with and not have daily or regularly, so people think, oh, I'm not going to eat meat, I'll just eat fish. But and the studies on that still support the fact that even though some people eat fish generally live longer than meat eaters, the longest lived still are the people that are mostly or nearly vegan.
Shanquila asks, what if you're blood type O positive? Do you need meat?
There's no correlation between blood type and the need for certain foods. That's a complete myth, and actually it's a scam, because there's no science, ever been a study to show there's any value in that. So it's a person just making something up out of the air with no scientific support to give it any credence. So zero scientific support for that. It's just nonsense.
Antoinette asks the question, we need vitamin B12, which only comes from animal products, correct?
That's correct. Animal products comes from bacterial fermentation, but we get B12 either from animal products, but those people, as they move their diet more plant-based and they become totally plant-based, then there's certain nutritional supplements they should be concerned about to assure they have an adequate amount of. I'm saying that it's most likely the highest potential for longevity comes from a diet style that's totally or near totally plant-based, with the conservative use of supplements to give you certain nutrients that would be more available through animal products, but that you're not getting now that you're cutting back on animal products. And that includes 3 primary nutrients. The main ones are, of course, vitamin B12, zinc. You get less zinc bioavailable absorption, especially as you age. And the last one is DHA and EPA, predominantly DHA, because the studies are showing that a low omega-3 index is associated with cognitive impairment and brain shrinkage with aging. And I've been advocating plant-based diets for more than 35 years now as a health professional. And I've been around taking care of a huge section of the vegan community, a huge number of vegans, and observed that some super healthy vegans, especially those in the natural hygiene movement who are eating all natural foods and no junk food, developed neurologic problems in later life. And when I checked their blood, they have very low levels of omega-3 index, was exceeding very, very low. So we're more careful to make sure as people go to a plant-based diet, they have a source of EPA and DHA. even plant-based DHA, and they take adequate B12. It's not okay just to consider B12. You have to consider DHA as well. And if you're looking to have optimal immunity, you probably should be taking a little extra zinc and sometimes iodine. If you're not using salt, the iodinated salt, and you're not eating any seaweed or seafood either, then you should have a source of iodine as well in your diet.
Now, with the omega-3s, do you test your patients for their omega-3 level?
I do. I'm recommending people do the test. It's not expensive. I think you can get it for $35, $40 today. And there was a recent study came out last 2 months ago that shows that people with a lower omega-3 index had years of life lost that was akin to smoking cigarettes. And we have so much data on the low levels being dangerous that and there's such a genetic difference as to people that convert ALA into EPA and into DHA effectively, and others don't. So some people don't need any, some people a little bit's okay, and some people need more. And because it's such a genetically determined conversion factor, I recommend most people take the blood work to make sure their omega-3 index is above 5. The blood test is called an omega-3 index, and we're looking for levels above 5.
Yes. Easy to do, not expensive. Everyone should check that.
Not expensive, right?
Yeah, just check it because it's a reality check on how you've been living life so far. Is your brain getting enough?
And if you're overweight, it lowers your index because the more fat you have on the body, the more it dilutes the percentage of omega-3 on the blood cell membranes and on the cell membranes. So a lot of times you have to lose weight to get your index up because you got to lose some of the omega-6 fat so the omega-3% is higher. You know what I mean? So people are taking the omega-3 fatty acids, the DHA, but their level's not great because they're still too overweight.
Now, I'm going to do a reality check here for me and for many of the listeners. Dr. Joel Fuhrman is one of the world experts who's been around for over 30 years talking about the benefits of not eating much meat. And you can't argue with the science. He's right on the money. You can't argue with this. And yet, and I know this, and I know most of the science that he talks about. We just had meatballs for dinner with Gio, that every once in a while we're eating meat, maybe 3-4 times a week, which is more than what Dr. Fuhrman recommends. And he's the world expert. So I'm not perfect, and none of you have to be perfect. But the more you head in the direction of what Dr. Fuhrman's suggesting, the more you move that way, the better your body starts to function. And you'll notice that if you push too far, you have a prime rib or something, you feel terrible for 2 days after, well, I'm not going to do that anymore. You'll learn and you'll experience more of this. Now, Dr. Fuhrman has a master class, and his master class is to teach you about these concepts at a much slower pace than just like right now answering questions, which is so overwhelming for somebody to try to absorb all of this. And we'll put the link in here for the master class. Go check it out, because this guy is world renowned. He's the best, and that's why he's here today. That's why we invited him here, and he's kind enough to be here, even when he's in the airport, about to travel, right? So if you feel a little overwhelmed by what he's saying, that's okay. That's okay, because it's a paradigm shift. It's a different way of thinking for many of the people that are here today. And I fully understand that. So don't throw the baby out with the bathwater. Just understand that the more you head in this direction that he's talking about, the better your metabolism's going to be, the better your brain's going to function. There's no question about that. There's too much science about this. And he's got 7 books that you can read on this if you want, but I personally would rather do the master class and hear the latest information.
Yeah, the master class is a series of 9 lectures that are for free. And I feel as people get more information and they see the science and they see how delicious this can taste, they can really get motivated to make changes and to make them comfortable and delicious and effective. Because I'm saying, don't be overweight. don't have high blood pressure or diabetes, don't control it with medications, get rid of it. And if whatever you're doing is not getting rid of it, then you're not doing the right thing. The proof is in the pudding. It's okay to do whatever you want, but if you're overweight and have medical conditions, you better do something that works.
Right, right.
If you're using medication, you're fooling yourself if you think controlling your glucose with a drug or lowering your blood pressure with a drug is protecting you. Actually, a study came out just yesterday showing that statin drugs to lower cholesterol almost do nothing. They hardly ever, they don't affect your overall lifespan, because you can't expect to drug yourself into a long life. You have to eat yourself into a long life, and it's got to be your lifestyle. You can't go to doctors and get drugs. I don't go to doctors. I don't even go to myself.
That's a bumper sticker. Priscilla asks, I eat essentially a highly stylized paleo diet as a result of later in life diagnosed celiac disease and hereditary fructose intolerance. I can't tolerate lectins. So how do I reverse these conditions and get back to vegetables?
That's right. I mean, the person is pushed over so their immune system can't get rid of the illnesses they have, including their allergies, because your immune system can't function normally if your phytochemical intake is low. So it's never the case that people are sensitive to all the lectins in foods. Lectins are anti-cancer beneficial parts of food. It may be some individual foods they're sensitive to, and we can really work over this. But that case is obviously more complicated. She might be able to ask me specific questions in the forums on my website and communicate with me so I can give her more specific advice, because she feels she's been, at once she has two issues. One, she's been led in the wrong direction with bad information. And two, she has a more difficult condition where she's sensitive to certain foods that are healthy. So she needs some individual guidance.
Michael asks, is it possible to build muscle and lose fat on the diet you're suggesting? Do you consider the effects of having low muscle in old age? If you're in your 30s and non-diabetic, is it a bad idea to use a high animal protein diet to lose fat and build muscle, then switch to a diet that remains within your guidelines?
So you're aging yourself more rapidly. And I'm saying that every day counts. Every meal counts. Why promote disease and then look to undo it? What do you mean you can't build muscle into later years? What is he talking about here?
Right. Good question. I don't know.
And if you want to see my six-pack, I can show you that too. But I'm 68 years old, and and my love is doing high-intensity sports that I did in my young years. So I'm heading to Salt Lake City for mogul skiing, and I'm playing singles tennis and surfing and climbing mountains and enjoying my life. And you get muscular and strong, and that's why the top athletes in the world in endurance sports, tennis players, basketball players, soccer players, skiers. Look at Eric Schlappi, who was in 4 Olympic Games, who prolonged his career in downhill skiing. Look at the top tennis players in the world, Nadal and Djokovic and Murray and Federer, who carry around their Vitamix blenders and have blended salads and eat all their green drinks and do all the things to stay young and youthful. And look at Tom Brady, who's changed his life of his career. We're talking about, I'm the 68-year-old version of Tom Brady.
Amen to that.
Because I'm really an athlete at heart. I was 3rd in the world in pairs figure skating in the 1970s. And I just have a love for like flying through the air and doing things physical. So we want to keep, so there's no reason you can't be super strong. And the high protein desire to get excessive muscle, like linebackers on football teams who weigh 250 pounds, because I'm not going to build 250 pounds of muscle eating the diet we're eating. We're going to get strong and lean. We're going to be able to do a lot of chins and be able to do, be strong and last a boxing match, for full 16 rounds and not get tired, or to play a tennis match for 4 hours. But you're not going to be a 250 to 300 pound linebacker. But who do you think, what profession do you think has the shortest lifespan of any occupation in North America? And the answer is linebackers on football teams who eat to get exceptionally large. And they're even short in their life when they get too large and get too much muscle from all the meat they have to eat to get that large. So largeness is not all we're doing. We want leanness, strength per body weight, and slow the aging process to maintain our athletic abilities as we get older and not to get older so young. The other way is going to age you faster.
Yeah. Are there any foods that I should avoid since I have ER-positive breast cancer?
Yes, you should avoid everything. You should almost avoid everything that got you to have the cancer to begin with. In other words, we have the anti-cancer diet that includes using some juicing, because we want to get the levels of nutrients up quicker and absorption up quicker. So we're giving them a salad every day, the vegetable bean soup, but also this three-part juice that's 1/3 green and 1/3 green cruciferous like bok choy, 1/3 lettuce, and 1/3 carrot and beet. And we want people to probably make this juice and have it day 1, day 2, and then the other day after 2 days, make a new batch of juice, but eat this otherwise nutritarian diet. I have specific dietary protocols for maximizing lifespan or reversing cancer. And we've got many hundreds of people with early stage cancers that have reversed them, and some with late stage cancers that have done well. I have people with non-Hodgkin lymphoma made a complete reversal. I had a woman with a stage 4 ovarian cancer with 4 liters of fluid taken out of her lung in 1997, who's still alive today, was given 6 months to live and still doing well and doesn't have ovarian cancer anymore. I have actually multiple women who are still alive after a decade of their diagnosis of ovarian cancer. We have women we have lots of people with men with prostate cancer with high PSAs that came back to normal, who had early stage prostate cancer came back to normal. We're saying that the same diet style that prevents cancer can enhance longevity, prevent recurrence, and in some cases induce a reversal in people who already have cancer. So it's never too late. Get into the program. And for you, I do recommend to see all these cases and to see all the latest science. I'm really recommending you read that book, but join the masterclass, get the information. I'll talk to you a tremendous step-by-step instructions and all the science that support it. You could read the books, watch the masterclass, and this is the type of thing I'm doing right now, is getting this information out, no charge, so people can understand it well and apply it to their lives. Let's save some lives here. So I really appreciate this opportunity to spread this information, give it to people for free, for no charge, and to get it out there in the world of as many people as possible to improve their diet. And as Dr. Tom said a minute ago, wherever you're at, you can do better and you can learn more, and you can become motivated, and you can find that this is enjoyable to give you security, emotional satisfaction, and gratitude. You're not saying, you're not giving up all the things you like to eat. You're enjoying food more, not enjoying food less, because you're intellectually and emotionally have the gratitude and amazement in what foods can do to the inside of your body, to protect your body, to make them taste great at the same time, and to really arm yourself and arm your immune system with the ability to resist disease and to reverse disease.
Amen to all of that. Amen. Right on the money. I could not say that any clearer and any more straightforward. You don't want to try to medicate your disease. You want to get rid of the disease. And the way to do that is first by focusing on what's on the end of your fork. And with Dr. Fuhrman and his masterclass, you're going to learn a lot of the best principles of how to focus on fruits and vegetables in a balanced way. So everyone, just copy that link, go sign up for the masterclass. It's free. It's really marvelous that you've done that, Joel. Thank you so much for doing that. That's really great.
Yeah, thank you.
And the time just goes so fast. You know, we've been at this for an hour already, and you've got a flight to catch. And I just want to thank you for taking the time in the midst of your travel to do this with us. It's really a pleasure, and I'll look forward to our next time.
Good luck to all you guys. Best of health, and wishing you all the best.
Thanks very much, Dr.
Keep
Fuhrman.
doing it. Keep doing it.
Amen. Thank you, everyone. See you next week.